it is Miss Lynn. I am here at Memorial Drive Veterinary Clinic with Dr. Maura Mansfield and my cat, Frodo. Frodo is about 3 years old, we think. He came from the Humane Society. We've had him for not quite 2 years, and we're going to start our tour with a little checkup for Mr. Frodo.
Okay, Mr. Frodo, let's get your weight. First thing, let's see if you gain. Okay, we're going to turn this to 0 and put you on there. Okay, big boy. What do you weigh? What? Oh, you want to pick him up one more time?
Oh, sure.
Yeah. Hang on. There you go. Wow, 8.5 pounds. You're such a big boy. Growing up so big.
He likes to eat. He even stole a pork chop off a plate one night at supper time.
Oh, that's naughty. That's naughty. Okay, so now I know when you were at the Humane Society, they gave you a microchip. And this is a scanner. We're going to see if that's still working.
So, why is it important to microchip your pet, Dr. Maura?
Well, the biggest thing is it is a way to, in case your pet would get lost. All you have to do with the wave of a wand, okay, not a magic one, but this, and we go over and see these numbers came right up with a little beep. And that tells me if I enter this into the registry computer, it will say Miss Lynn owns Frodo. I want to return this cat to Miss Lynn so it can be happy once again. So anytime we have lost pets, this is a fantastic way of reuniting them with the family.
And I did go online and fill out my part of the registration. If I didn't do that, would they be able to find out that Frodo belonged to me?
No, they would only know that the shelter had seen the cat, and then perhaps it could get traced, but it's possible, especially if you move, that would never be found.
That I'd never get my kitty back.
So anybody who moves also has to re-register to say, this is my new house in Florida and, Alabama, so that kitties can be, or puppies can go back where they belong.
Excellent.
Currently, kitties, dogs, and birds are microchipped. Not too many other pets are.
Okay.
Okay?
All right. And what else do we need to do to make sure Mr. Frodo stays nice and healthy?
Well, we're going to look from nose to tail and just see how well we're doing here.
He's a very curious kitty.
Yes. Let's face him this way so I can get a
this
good
way,
look.
Mr. Frodo.
First, we're going to look in your eyes. We're going to make sure those pupils are working. Make sure no red, no itchy. Okay, let me see. Okay, handsome devil. Okay. My patients are wiggly. That's our challenge. Oh, the eyes look gorgeous. Let's go look in the ears. Make sure no itchy wax. Sometimes there's even bugs down there, but I don't think Frodo's going to have any. Okay, Miss Lynn, thank you for helping me. Oh, Frodo's a little itchy. Looks good. Let's see. Oh. Yeah. See, maybe the camera can look down. See, there's just a little.
That's very cool.
Okay,
Good job,
so
buddy.
now we're going to see Mr. Frodo's teeth. That's important for him chewing, and a healthy mouth is a healthy body for people and for pets. Okay, he's got a little bit of tartar, but overall his gums are nice and pink, which means his heart is doing well too.
Can I do anything to help him with that tartar?
It'd be amazing if you could brush his teeth.
I do have a little animal pet or toothbrush at home and some toothpaste. We will start trying to brush Mr. Frodo's teeth. How often should we do that?
So it's best to do it daily, just like us, but even a couple times a week is a huge help. There's chicken flavored toothpaste these days, which, and sometimes even fish flavor if you look real hard. So let me listen to Frodo's heart if that's okay.
As you can hear, he's purring pretty
He is
loudly.
purring. It might be hard to hear his heart, but we're going to try.
He's a happy guy to
He
be at the
is a
vet.
good boy. You see his bow tie? He is ready. He is a looker today. Okay, one more time, babes.
You're a good boy.
So I'm listening between the purring. He needs to maybe just come a little out.
Okay, let's
So
try
he doesn't tingle.
bringing him back out here.
Yeah.
There we go.
There we go.
There we go.
There we go, kid. There. Perfect. Oh, his heart sounds so good. Now I'm going to listen to his lungs. Okay, now we're going to feel his tummy. Sometimes cats think that's ticklish, so we're going to see. Oh, no, he's brave. He's good. Okay, so no lumps and bumps. Let me feel his glands. Let me feel his armpits. Let's check your hips out, little one. Mm-hmm. Yeah. Let's count your toes. They look good. Mm-hmm. Mm-hmm. How's your shoulders? Right? Head, shoulders, knees, knees and toes. He's all good.
All right.
Okay. So then the last thing we do is a little comb through just to make sure his skin looks healthy. What do you think of that, Mr. Frodo?
Oh, he likes to be brushed and combed.
Oh, good. He's such a good cat.
Except when he's stealing pork chops.
Oh,
And bread. He likes bread.
I had a bread stealer. They just love to sneak stuff.
Well, it looks like you're making sure he's healthy from head to tail.
Head to tail.
How often do kitties need to be seen? Or even our dogs, how often should they come in to be seen by the vet?
So we like to see them once a year when they're adults. When they're babies, they need to be seen a few times just to make sure they're growing properly and also to get their vaccines. Okay, so for vaccination, which there's little shots to keep them healthy, we need to see them once a year. When we get older kids, by kids I mean pet kids, okay, not people kids. When we get older pets that are senior citizens, it is nice to see them twice a year, because 1 year for a dog or cat is 5 to 7 years for us.
Wow, right.
So
Good to know.
so when they're not feeling as good in their older age, it's just better to keep things up to snuff and check them frequently.
All right. Well, thank you so much, Dr. Mora.
Well,
I'm
you're
glad to
welcome.
see that Frodo is healthy. We are going to take a quick break, and then we're going to be back. We're going to do a tour of the clinic. So we'll be back in just a minute.
Yay.
And we are back with Dr. Mora Mansfield at Memorial Drive Veterinary Clinic. Dr. Mora, how long have you been a veterinarian?
Well, Miss Lynn, I have been a veterinarian for 30 years
Oh
now.
my gosh.
Yep, 30 years this summer.
How long did you have to go to school to become a veterinarian?
Well, it's a little different now, but I went 4 years of college and then 4 years of vet school, and then I did an internship.
Okay.
So I really did 9 years of training before I even
Wow.
was.
That's a
Mhm.
long time to go to school and do your training. What is your favorite part about being a veterinarian?
Every day is different. I never know what I'm going to see. Every day is a surprise. I love seeing everywhere from the puppies and the kittens that grow up to be, not 20 years old, to somebody's rabbit, or sometimes help at the zoo. Yeah, I never know what's going to happen. Sometimes we help the wildlife groups around here, seen bald eagles. I love it.
Awesome. And kind of on a daily basis, what's the most common thing that you do at work? Is it checkups like we did for Mr. Frodo?
I would say that's maybe a third of what I do is healthy checkups, making sure they're up to date on what they need. And the rest would be seeing sick pets, diagnosing, say what is wrong with you, what could be making you not feel good, and then finding the answer to fixing that and keeping them well. And it's very satisfying. It's a nice feeling. And then sometimes we do surgery. Sometimes they swallow things like rocks, balls, as Miss Julia showed, and we have to take them out. The spoon. Sometimes they have things in their body that don't belong, that their body forms, and we have to remove it so that they can feel healthy again.
All right. What is the most unusual case that you've worked on?
Probably the most unusual case was at the zoo, and it was a Pope's pit viper, which is a really poisonous snake. And this was at the New Orleans Zoo, and they brought in 4 specialists because this is a poisonous snake. And he was dizzy, and he kept falling over and rolling. And so they had to scoot him in a tube because he didn't want to get bit, make him fall asleep with a little gas put in there. And then they drew blood, did some tests, and we found out he had a parasite.
What is a parasite?
A parasite is a little organism, sometimes a big organism, that feeds off another and steals from it. So this one was a microscopic one, meaning you can't see it with your eye, that was in the tummy and also went to the brain.
Oh my gosh.
And when we treated for the parasite, it got better. So even though he was poisonous and not very nice, we still helped him.
Oh, that's awesome.
Yeah, so that was one cool day.
Very cool. Speaking of snakes, Dr. Moore has some unusual things that she's going to share with us right now. You ready to take a look? Let's find out.
So speaking of snakes, one of my co-workers owns a snake, and I don't know if you know, Miss Lynn, but when snakes grow, they get new skin all the time, and then they shed the old.
It's creepy, even though it's just skin.
It's just skin.
No.
And look how big her snake was, and it kept the whole one intact.
Oh my gosh.
Yes.
That's too big for my liking.
So, and then some people keep unusual pets like tarantulas. This is a tarantula skeleton of one who passed a while ago.
Oh, thank goodness it's just a skeleton. I don't like spiders.
No, he's not
either.
going to move. But you can see how fuzzy he is. But then you also see his big fangs. Yeah, so I don't treat tarantulas, I do have to say. And if somebody wanted to bring me the rattlesnake, I probably would say no. And I have been asked. Yes.
All
So.
right.
Mm-hmm.
All right.
So, would you like to see some more of the clinic?
Oh, I'd love to see some more of the
Right,
clinic. Normally we don't get to see that. We come in here with our pets, and that's usually as far as we get. Let's go check out what's...
So remember when we talked about that teeny tiny parasite? How we see those is we make a slide, and we put the slide under here, and then we look in here, and it makes the small very big. And that way we can find out things we could not see with our bare eyes. So that's how we helped the snake that day.
Oh my gosh.
This little Dalmatian is getting ready for surgery. You can see he's got a little bit of gas coming and some oxygen. And then we clip his fur to where we're gonna maybe make a little, like remove a lump or something that doesn't belong. And then we stitch him up and he goes home. This puppy is going to go home today. He had a fever and we gave him some medicine, some antibiotics. Now he's feeling better and he's going to go home to his mom and dad tonight. Okay, this is our x-ray room. When you've seen the x-rays, we lay the patient down. Then, we lay the patient down, we click the clicker, and then we see the insides, whether it's a broken leg, swallowed something, or maybe a bad cough. That's how we figure out what's going on the inside. This is a picture of a cat heart. This cat wasn't feeling very good, so we actually put this probe up right here to the chest, and we can see the inside, and you can see the heart pumping before your very eyes.
That's really cool.
Wow, that's awesome.
This is also where we clean teeth. These tables are great because when they drool, it goes right down there, and we can clean their teeth just like you and I get, but they have to be sleeping because otherwise they will bite the instrument. So we clean teeth every day of the week except for Saturdays. And clean teeth equal a healthy body, so it's really important. So we are very happy to do that for them.
So neat, and I'll get a close-up of the...
Thank you so much, Dr. Mansfield, for checking out Frodo to make sure that he's healthy, for showing us what happens behind the scenes and some of those creepy things that you shared with us as well. This was an awesome tour for us. Thank you again.
I had a great time. Thanks to everybody for tuning in.
All right.